Well, not even a year after changing the governance structure of our health system, the government is switching it again, announcing the end of the reign of Health Commissioner Lester Levy and reinstating a board. Minister in charge, Simeon Brown, is also promising to clear the backlog of more than 10,000 elective medical procedures by the end of June. Here's Imogen Wells.
Our new look health ministers itching for change.
I'm very much focused on putting the patient back at the centre of every decision.
Announcing today he's scrapping the Lester Levy-led commissioner structure put in place in June 2024.
Minister, have you effectively sacked
No.
Levy today?
I have full confidence in Professor Lester Levy.
Levy's contract for heading the health sector was only for a year. Now it's back to basics and a board.
Is this an admission then that the framework your government put in a year ago was the wrong thing to do?
No, it was the absolutely right decision at the time.
This government has unleashed chaos on the health system. I'm pleased today they are taking the step to turn it around.
Levy's time at the helm hasn't been smooth sailing, with a handful of high-profile health resignations and controversial attempts to balance the agency's $30 billion budget.
Lester Levy has been incredibly destructive and secretive as a commissioner.
Look, he has been doing a great job.
Some in the sector not overly pleased with the governance flip-flop.
From our perspective, we will work with whichever government's in power. We will also work with whoever's in the health leadership roles, but it's very challenging when you have a revolving door.
The commission was never intended to be in place for a long period of time. It was there to make sure we stabilised Health New Zealand.
The minister's so confident it's stable enough, he's also announced a $50 million package to clear a backlog of 10,500 elective procedures between now and the end of June via a partnership with the private healthcare sector. Some back-of-the-envelope maths will tell you that's more than 90 additional surgeries a day for the next 115 days.
Is that achievable?
I think that's a huge challenge. Moving things into the private sector doesn't suddenly make a whole bunch of new surgeons and nurses. It just means that you've got at least some new theatres to use.
We meet with many of the private hospital providers. There's a lot of capacity, but more importantly, we also want to make sure that there's a partnership going forward.
A partnership that could potentially, though, mean less opportunities for trainees in the public system.
And if we're going to move patients to the private sector, it's essential that as we do that, we ensure that our trainees can go with those patients so they can learn and acquire the skills that they need to be the future surgeons for New Zealand.
It's not just an ad hoc, do something for 3 weeks as it's been in the past. It's actually a long-term partnership so we can actually grow a shared workforce together.
It's not a long-term solution. A long-term solution is having an appropriately funded public health system that's equitable for all.
Simeon Brown might be National's Mr. Fix-It, but finding a band-aid big enough to fix the health system will take more than a new board.